Hello, everyone. For my project this semester, I chose the virus influenza. All right, let's get started. So, a little bit about influenza virus. What is influenza? Influenza is a single-stranded RNA virus that makes people ill every year. This virus has been around for many years, causing many pandemics over time. A notable pandemic that was very bad was the 1918 pandemic H1N1 virus, which is also commonly known as the Spanish flu. It had 50 million deaths worldwide, which is about 1/3 of the population. And at the time, there were no vaccines against this virus. So there was only so much that they could do to keep people, I guess, healthy or alive. Supportive care and limited technology was used to treat these patients. And by supportive care, I mean like staying home, using home remedies, making the patient comfortable so that they could feel better. They had non-pharmaceutical interventions to take place to control the virus, like isolation and quarantine, better personal hygiene, and better disinfecting methods, as well as to limit to public gatherings, kind of like what we've seen throughout this whole pandemic thing. Now it's not as bad because, we walk around, we don't wear masks, but, in 2020, we were quarantined, we had disinfecting everything. We ran out of disinfecting wipes, bleach, for some reason toilet paper, but yeah. And as a result of this flu virus, there was a shortage of medical personnel. So kind of like I mentioned, kind of like 2020, where we also had a shortage of medical personnel in the hospitals. And so, yeah, this virus can be very, very scary. So some characteristics of the influenza virus, the molecular ones to be specific, is that it's a negative single-strand RNA virus. It is a segmented virus with up to 8 segments. And influenza A has 7 segments. It replicates in the nucleus, has a helical ribonucleocapsid and a ribonucleoprotein. It is enveloped, and there are different types of influenzas, but influenza A is the most pathogenic influenza, meaning that it makes us the most sick. Influenza is classified into different subtypes according to their hemagglutinin, neuraminidase, and the proteins of the surface of the virus. That's how we get H1N1, H1N5, and all those different types. Some characteristics of the infection cycle are that they can undergo reassortment, where the virus swaps gene segments. This occurs when the different versions of influenza viruses co-infect a cell. They accumulate mutations that can lead to an antigenic drift in viral reassortment, meaning that as a result, there's new strains of the virus each year. This is a zoonotic virus, which can be transmitted from wild waterfowl, like birds, like ducks and geese, birds that kind of like live in the water, to domestic poultry, pigs, and other mammals, and us humans. So here's some symptoms of the influenza virus. Common symptoms of this virus are sudden fever, dry cough, headache, muscle pain, joint pain, sore throat, chills, a runny nose or a stuffy nose, and fatigue. Kind of like what you'd see similar to COVID or just the common cold, but just a little bit worse. Most people recover within a week, but there are groups of people that are most susceptible and as a result have life-threatening illnesses or can have other complications like difficult breathing, fever above 104 degrees Fahrenheit, and if they're already sick, they get even more sick. Kind of like if you had a cancer patient get the flu, because their immune system is not the best, they'd get even more sick compared to a healthy individual. I know this because my mom had cancer a few years ago, and her doctors always told her, get this vaccine, get the flu vaccine, because of the slightest, even if it was just a common cold, but the slightest bit of illness that she'd get, it would be like 10 times worse. So who is at risk? Everybody is at risk of obtaining the flu virus. No matter the age or who you are at risk of obtaining this virus because it is very easily transmitted through particles that we breathe. So specifically though, people older age and people that are immunocompromised and have a weaker immune system, like I mentioned earlier, cancer patients, for example, can experience severe illness or death due to this virus. In addition, pregnant women and children under 59 months old are also very susceptible to getting this virus. In addition, healthcare workers and people working in public education are also at risk, mostly because they see, well, for example, healthcare workers, they work with the sick, they exposed to different types of viruses, including influenza at their workplace, and people in education, like teachers, that work with little kids, like pre-K or elementary schoolers, they are exposed. And, children don't have the best hygiene per se. And so if they're sick, they are more than likely to get other people sick, including their teachers. So what can we do to limit the spread of this virus? What are some preventative methods? Vaccines. Compared to 1918, now we have developed vaccines. And you can get this vaccine every year before the flu season starts to help you combat this virus. Where can you get them? You can get them at a local clinic, pharmacies like HEB, Walgreens, CVS. I know Kroger has them as well. Hospitals, you can also get them there. And some other ways to help prevent the spread of this virus is proper hand washing. If you're sick, stay home, avoid people, practice good respiratory hygiene methods when you're already sick to prevent the spread and create possible fomites, meaning that if you're already sick, cover your cough, cover your sneeze. If you blow your nose, throw away all infected tissue paper, wash your hands before touching other things, because you could get other people sick. And like I mentioned earlier, some people might have already chronic illnesses or weak immune system. So if you get other people sick, they might have it worse than your case. There are other populations that are at risk as a result of preventative methods like the vaccine. So although we have developed a vaccine to help maintain this virus every year, there are certain groups of people who are not able to get this vaccine and therefore becoming more susceptible to this virus. People like homeless or people who have low income often do not obtain the vaccine due to lack of insurance or availability to cover for it. So it is common to see, like I mentioned, homeless people get sick every year because they don't have the resources to go and get the vaccine, or people with low income. It might cost them a little bit more, they could manage the money, like, oh, should I go get a vaccine or provide food for my family with this money? So that is something to keep in mind of when thinking of these populations that are at risk. In addition, there are also certain groups of people who might be able to get the vaccine and have these resources, but they choose not to. Due to information they obtain from others or the internet that might be misleading. Some common misconceptions that they often, I guess, bring up of why they don't get the vaccine is because if they think that if they get the flu vaccine, they will also get the flu. So they rather not get the vaccine, but which is not false. The vaccine will help you create those antibodies that you need to, combat this virus, and might have some side effects, kind of like the COVID vaccine. People would get it and they'd have like slight chills, fever, but nothing compared to the actual virus. And so that's the same thing with the flu vaccine. And so people have said that, oh, I got the flu vaccine, I still got the flu, and I felt sick. Well, like I mentioned, the flu vaccine is, it's not like you get the vaccine and you don't get the virus ever. Like you're still susceptible for it, but they're just antibodies to help your body fight the virus back so you don't get as sick. Other things that they've said is that I got the flu vaccine last year and therefore I am protected for this year, which is absolutely not true. As mentioned before, this virus can go through reassortment, and as a result, new strains of this virus appear every year, every flu season. So the vaccine that you might have gotten last year might not work for you this year. So it is important to go to your local pharmacy or any healthcare provider to get your vaccine for this year's flu. And another one is that I'm healthy, therefore I don't need the flu vaccine. That is not true. Just because you're healthy doesn't mean that you can't get the flu virus. I know certain people that they're like, oh, I'm a healthy individual, leave the vaccines to people who are sick. I should be okay, but that doesn't guarantee you that you will not get this virus. People go to the store, people go to many different areas, the gas station, school, anywhere, and they could have the virus, and you could go and touch a potential fomite and then touch your face, touch your mouth, touch your nose, and then you get infected. And if you're not vaccinated, well, it's not going to be pretty. And you could also get other people sick. As I mentioned before, you can come home and get your family sick. And so it is always important to get the vaccine and help inform populations that do not have the proper information on why they should get this vaccine. I know I struggle with this because my mom she does not like getting the flu vaccine. She doesn't think, she's one of those people with these misconceptions that she's like, oh, I don't need this vaccine because last year I got it and I got sick. But, it's just all about informing these groups of people, making sure that they have the proper information to stay healthy and avoid the spread. These are my sources, and thank you.